Welcome to RT4RN. My name is Joe Lewis. I'm a registered respiratory therapist times 20 years, and today we're talking all about oxygen therapy, specifically about the 4 of the most common devices you're going to see in the clinical setting. We're talking about the nasal cannula, the simple mask, the venturi mask, and the non-rebreather. Now, to talk about these, I'm going to break them down for you so that you have a better understanding of the flow that should be delivered for these devices, the FiO2 that they deliver. Now, when I say FiO2, that stands for fraction of inspired oxygen. It's the same as saying percentage of oxygen delivered. And then we're going to talk about the key points that we need to remember, because each of these devices have some very specific things that you have to remember in taking care of patients with these devices. And of course, all of this knowledge is for your sake, for your betterment, so that we can all provide better care for our patients together. Now, the first device we're going to talk about is the good old nasal cannula. Now, most of y'all have probably seen this, and if you haven't, then when you get into the clinical setting, you're certain to see one of these at some point. Now, the way this is placed on the patient is the prongs of the nasal cannula just fit right inside the nares, and then we go around the ears and underneath the chin. Now, this snugging it up underneath the chin is important, because if it stays super loose like this, then when the patient moves, this may slip and look something like this, and that's not proper administration of oxygen for this patient. So we want to snug it up underneath the chin, not tight. You're not going to choke the patient, obviously, but just bring it in kind of snug there so that as the patient moves and as they sleep, this doesn't become dislodged in loose placement. So what do we need to know about the nasal cannula? Well, when we look at the flow, okay, so we look at flow of a nasal cannula. A nasal cannula should be set anywhere between 0.5 to 6 liters per minute. This is what we set on the flow meter. Okay, now some flow meters, and you get into the neo world and the pediatric world, they'll even go down to 1/4 of a liter, and that's perfectly acceptable also. But primarily in the adult world, we're going to be looking at 1/2 liter up to 6 liters per minute. Now, what this does is this flow of oxygen delivers approximately 20 to 40% oxygen. So your FiO2 is actually 0.22 up to 40%. Now, maybe you can get up to around 44%, slightly higher than 40%. For the most part, you can tell we're going to be given low percentages of oxygen here. Now, what do you need to remember about the nasal cannula? Well, the most important thing to remember is that the max setting is 6 liters per minute. We don't want to go in and find a patient on a nasal cannula. Let's say they're on 5 liters per minute and their oxygen saturations are 85%. Well, maybe you bump them up to 6 and they go up to 87%. And we're trying to get them up to above 92%. Well, we're going to stop there. This patient needs another device. Anything greater than 6 liters per minute isn't really going to do anything except for cause discomfort for your patient, all at the same time of not meeting their oxygenation needs. So you get to 6 liters per minute, that's where we're going to stop, and we'll change to a different device. Now, also remember that with the nasal cannula, your patient may complain of dryness in their nose and the back of their mouth. This is because the oxygen coming through the device is dry. So we can always add a bubble humidifier to a nasal cannula, absolutely every time we're greater than 4 liters per minute. But even if your patient is complaining about this at 1 or 2 or 3 liters per minute, it's perfectly okay to add a bubble humidifier to this patient. You can always call your respiratory therapist and we'll get that added on there for you. Now, the second device we're going to talk about is what we call the simple mask. It looks like this. You can see that it fits over the mouth and nose, and then this goes around the back of the head. Now, this device operates off of flows between 5 to 10 liters per minute. Now, when we set this device up on 5 to 10 liters per minute, we're going to be delivering somewhere in the ballpark of 35 to 50% oxygen. Now, this is important because with the nasal cannula, as well as with the simple mask, we know what range we can deliver, but we do not know exactly how much oxygen we are delivering to our patients. If you think about this in the same likes of morphine, then you would probably like to know how much morphine you're actually delivering to the patient. You want to give enough to take the pain away, to fix the problem, but you don't want to give an excessive amount to where hazards become into play. And like morphine, oxygen is a drug. And so it's nice to know how much oxygen we're given so we can ensure that we're not giving too much, because oxygen also comes with hazards. Now, what do you need to remember about the simple mask? Well, the nasal cannula had a max. The simple mask has a minimum. You never want to put this device at a flow less than 5 liters per minute. 5 liters per minute is the minimum you will ever go with the simple mask. Now, the reason that is because as the patient inhales and exhales into this mask, if the flow is less than 5 liters per minute, then you can run the risk of CO2 buildup inside the mask itself, which is going to lead to rebreathing of that CO2, and it can ultimately cause the patient to go into acute ventilatory failure with a high CO2 and a low pH. We don't want that. So remember, 5 liters per minute is your max all the time. You go in, your patient is oxygen saturations are 98%. They're on 6 liters per minute on a simple mask. You don't want to turn them down to 4 liters per minute. That won't work well for your patient. It's not proper use of the simple mask. Now, the other side of this is if you go into the room, to your patient's room, and you find them on a simple mask, and you see that they're only on 3 liters per minute, then you know we need to increase that to 5 liters per minute. Reach out to your respiratory therapist. Maybe a simple mask isn't needed anymore, and we can get them on a whole new device, just like we talked about with the nasal cannula needing more, right? So keep that in mind with the simple mask. You don't want to forget that. Now, I'm going to keep hold to the simple mask here because I want to show you the next device is called the Venturi mask. Now, I want to hold these up side by side so you can see the difference. The simple mask, you can kind of see where the oxygen tubing comes straight into the mask. With the Venturi mask, you can see where you've got this green device down here. This is what we call the Venturi device. This is actually entraining room air. So some people refer to this as an air entrainment device. So with this device, we can actually control the exact amount of FiO2 that we are giving to the patient that's actually being delivered. So this is a good thing. Now the Venturi mask can deliver 24 to 50% oxygen. That's how much it can deliver. Now this is what makes this mask unique, because with the nasal cannula and the simple mask, remember I told you, we have flow ranges that equate to FiO2 ranges, but we don't really know how much the patient is getting. With the Venturi mask, we know exactly because we dial it in down here with this little device. So if you can see, there's a little window right there, this little window. This is where 100% oxygen is coming in, but then room air entrainment is diluting it down to whatever is set on the setting. There are various makes and models of the Venturi mask. This one is a one-piece device. Other ones have different pieces that you have to take out and plug in. They're all fit to deliver specific FiO2s. Now, the flow for these devices range anywhere from, this one says 3 liters to 6 liters per minute. So we could go anywhere from 3 liters per minute, maybe up to 8 to 10 liters per minute, depending on the specific manufacturer of the device. So that's your flow. The thing to remember about the Venturi mask is that changing flow does not change FiO2. So you go in and you find your patient with an oxygen saturation of 85%, and you think, oh, I need to give them more oxygen. Well, if that patient is on a Venturi mask, you go over to the flow meter and you turn it up from 5 liters per minute to 8 liters per minute, then yes, you have increased the flow to that patient. But you have not changed the FiO2 based off of the principle of the air entrainment device. So the FiO2, let's say they're on 40% oxygen and they're setting 85%. You turn that flow up from 5 to 8, the patient is still only receiving 40% oxygen. So we have to actually change the FiO2 setting on the device to actually increase the amount of oxygen that will be delivered to the patient. Now this device is kind of tricky because, if you take a simple mask at 10 liters per minute, you may be delivering 40%. This device may only be set on 6 liters per minute, a lower flow, yet it would be delivering 50%. So you can see where things kind of get tricky with the Venturi mask, where flow does not affect FiO2 as long as it's an adequate flow, okay? So just remember that. The key takeaway is changing the flow does not change the FiO2. The final device we are going to talk about is the non-rebreather. This is the one that has this inflatable bag on the end of it, okay? Or from the insertion point, it's got this bag on it. Flow ranges 10 to 15 liters per minute. Now, when we set this at 10 to 15 liters per minute, we're giving approximately 80% oxygen. So this is what you'll get. So you can see that this device gives a much higher range than our nasal cannula, our simple mask, or our Venturi mask. It gives up to 80%. Again, we don't know exactly, but that's the approximation that will be delivered. If you ever come into your room and you have a patient that looks like they're in severe distress, or they're cyanotic, or you have a saturation of 80% and you can see an emergency situation on your hand, this is the device that you want to initially go to. So don't turn that cannula up to 8 liters per minute. Okay, you can turn them up while you call the RT or while you go get a non-rebreather, but just remember that this is primarily going to be used to deliver high FiO2s for emergency situations until we can figure out what exactly is the best device for this patient to be on in that and for that situation. Now, what do you need to remember about the non-rebreather? It's very simple. Don't let the bag collapse. So when you hook this up to the oxygen flow meter, this bag will inflate. If you ever come into a room and see the bag fully deflated on a patient, it is not operating correctly. Your flow is not high enough, and we need to increase the flow to the non-rebreather. Now, if it's partially collapsing, that's okay. The key is while a patient is breathing with this device, the bag should never look like this. Okay, so those are the 4 key devices that you're gonna see commonly. You want to be well versed in them. If you ever have any questions with them, do not ever hesitate to reach out to your respiratory therapist. We're here to help you to be a resource for you, all for the betterment of the patient. Okay, so let's just recap here real quick. The nasal cannula, don't put it above 6. The simple mask, keep it greater than 5. The Venturi mask, don't forget that changing the flow on the flow meter will not change the FiO2. And when you're working with a non-rebreather, we don't ever want the bag to fully collapse. I hope this video brought you some value. If it did, smash that like button for me. If you like the content in this, of course, I would love a subscription. But more importantly, what I'm asking you right now as a new channel, as an RT, I don't really know what elements of nursing related to respiratory therapy you know or don't know. So what I would appreciate more than anything else is comments below that would tell me, hey, talk to me about this aspect of respiratory therapy that'll help me be a better nurse. We're all in this together, all for the betterment of the patients. I appreciate you watching.